Hello everyone and good afternoon. My name is Valerie Campos. Today I'm going to give you some information on HIV and AIDS. Before we start with all the details, do you all know what HIV and AIDS stands for? Well, if you don't, here it goes. HIV is an abbreviation for human immunodeficiency virus, and AIDS means acquired immunodeficiency syndrome. HIV is a sexually transmitted disease but can also be spread by contact with infected blood or from a mother to a child during pregnancy, childbirth, or breastfeeding. It can take years for HIV to weaken your immune system to the point that you have AIDS. AIDS is a life-threatening condition that is caused by HIV. It damages your immune system and it interferes with your body's ability to fight the organisms that cause the diseases. According to the Central for Disease Control from CDC.gov, over 56,000 people in the United States contracted HIV back in 2006. And over 15 million people have had this disease since it was first recognized in the 1981. Anyone can suffer from HIV. It can be you, me, my friend, my relative, anyone can suffer, and it is our responsibility to take care and protect ourselves from any disease out there. Today I brought you some information about HIV with its risk factors, how it's transmitted, its signs and symptoms, treatment, and its test and diagnosis and its cure. Well, first of all, I want to talk about how it transmits. Anyone of any race, sex, or sexual orientation can be infected with HIV. But the ones who are at greatest risk of contracting HIV and AIDS are the ones who have unprotected sex. Of course, you don't use a condom when you're with your partner, which is very important for you to do. Or if you have another STI, which is a sexually transmitted infection, and you transmit it to others, it goes to HIV. Or you use intravenous drugs. People who use intravenous drugs often share needles and syringes, which can cause the blood to contract any infection from other people that you shared with. And also from a mother to a child. Infected mothers can infect their child during pregnancy or delivery or through breastfeeding. But if women receive treatment of HIV when they are pregnant, it reduces the risk of a baby to suffer from HIV. Now, some of the signs and symptoms for HIV and AIDS include fever, muscle soreness, rash in all of the body, headache, sore throat, mouth or genital ulcers, swollen lip gland, mainly on the back of the neck, and joint pain, along with night sweats, diarrhea, and many others. HIV destroys CD4 cells, a specific type of white blood cell that plays a large role in helping your body fight this disease. Your immune system then starts to weaken as more CD4 cells have been killed. You can have an HIV infection for years before it goes on to AIDS, which is, like I said, worse. According to the CDC, the Central for Disease Control from CDC.gov, people infected with HIV progress to AIDS when their CD4 count falls below 200 or they experience an AIDS-defining complication, such as pneumocystic pneumonia, cytomegalovirus, or tuberculosis, along with many other diseases. Well, you can go get checked with your doctor and expect some of tests and diagnosis to be a part of your procedure. HIV is most commonly diagnosed by testing your blood or saliva for the presence of antibodies to the virus. Unfortunately, this type of HIV tests aren't that accurate immediately after the infection because it takes time for your body to develop these antibodies. It usually takes up to 12 weeks. Sometimes it is rare, but it can take up to 6 months. So be sure to check every year and be aware of this problem. Unfortunately, there is no cure for HIV, but there are some medications that can dramatically slow the progression of this disease. These drugs have reduced AIDS over the years in different nations around the world. Some of these medications include non-nucleoside reverse transcriptase, or NRRA, RI, excuse me, I'm so sorry, along with many others. Well, as you can see, this disease can be very dangerous and you can eventually die. It is rare, but you will. Well, I hope this information gained you like a more a more detailed view of HIV and AIDS, of what can it do to your life, how can it affect other people and your partner. So please go get checked every year with your doctor. Even though you know you use protected sex, always do so. And well, thank you. And like I said, it can be you, the one who gets infected tomorrow, the next year, the past year you got infected. It doesn't matter. It can still be you. And if you don't love yourself, then no one else will. So might as well go get yourself checked. And well, thank you for your attention.